Okay guys, sorry I didn't do a video last week. We've made some changes to the bill. None of them are really that big of a deal. Some people may think some of them are, but basically one was to strengthen the bill to prevent online medical evaluations and basically cash for card type clinics. We added the term full medical evaluation and the definition for it, and that definition is full medical evaluation, the standard of care that applies when certifying individuals as candidates for use of medical marijuana is the same as that is expected in any other situation in which an individual is being evaluated for medical services. A special standard, higher or lower, is not called for in certifying patients for the use of medical marijuana. And basically that's just saying, you know, a doctor should take the same care in recommending marijuana that he would in prescribing any other drug. It also, you know, outlines some of the things associated with full medical evaluations, looking at your medical records, a hands-on medical exam, and those are just things that are already standard for, you know, a doctor if he's going to prescribe medication. Let's see. Because of the problems with the federal government and their stance on for-profit marijuana, it has been decided that we're going to go with a totally non-profit system, from dispensaries on down to co-ops. Everything has to operate as a non-profit entity. We've got the recommendations. We're doing something, I don't know if this has ever been done before, but the lawmakers had a problem with the way the bill was written. It says you can possess up to 8 ounces of marijuana, but it didn't put any limit on how much marijuana you could buy per month. So their argument was that as the bill read, you could go to if you had a card, you could go to a dispensary, buy 8 ounces of marijuana, go sell it on the street, come back 2 hours later, buy 8 ounces of marijuana, go sell it on the street, come back, and so forth. So they wanted to put limits on how much a patient could buy each month. And we discussed, you know, the differences in, you know, quantity and how much difference that can make in how much a patient uses, you know, within the same patient. And then, you know, you had patients, you know, who had greater need. And what we did is we came up with a schedule of recommendations. Basically, there's going to be 3 classes of recommendations. A doctor can, and this is totally up to the doctor what he recommends. They were, you know, they're fine with that. That's the way they think it should be. But the doctor could recommend you to be able to buy up to 2.5 ounces of marijuana per month, and that would allow you a total of 8 ounces of marijuana, or 8 plants, and 8 plants. The second one would be up to 5 ounces of marijuana per month, and you'd be able to have 12 ounces and 12 plants. And the final one would be up to 10 ounces a month, which I'm guessing would be primarily for people who are dying of cancer and that type of thing. But that would be up to 10 ounces of marijuana a month, and you'd be allowed 16 ounces and 16 plants. There's already been a lot of stuff said about the law enforcement provisions, but there will be a 2.5% tax going to both county and municipal law enforcement, and it is, let's see what the wording is. the wording on both of them, it just, one says county, the other says municipal. An additional 2.5% sales tax will be added to, will be applied to all medical marijuana sales. The revenue generated by this tax will be distributed to the state sheriff's departments to be used to combat the illegal trafficking and production of hard drugs. Hard drugs to be defined as all substances in Schedules 1 and 2 of the Alabama Controlled Substances List. Keyword there, Alabama Substances Controlled List. But I mean, those are basically the changes. There was a few little things here that didn't make any difference other than moving an and or this was or that kind of thing. But everybody seemed happy with it. The people that we've been working with anyway seemed happy with it. I have a meeting tomorrow with the chairman of the health committee, and we're going to see if we can get him nailed down on a committee hearing. As far as what date that will be, there's been a lot of speculation. I think something I said might have got misconstrued. I said that I hope we'd have a date set this week, and what I mean is this week I hope that we would set a date for it, not that it would be this week. So if that was a misunderstanding on my part, it was my fault, I apologize. But that's where we stand now, and everything's going good. We're still getting a lot of positive response. We've got lawmakers that I never thought we would get on board, that we've got on board, and right now I think we've got a real good chance. But we need to stay on the health committee. Keep those emails going. If you haven't emailed the health committee, it's going to be on Facebook somewhere. We'll make sure that it's up. And all right, I'll be back at it tomorrow. I'll talk to y'all later. Thanks. Bye.